We had a lot of good presentations and discussion this morning that set the context for the challenges currently facing us in acquisition. This afternoon, we're going to share some of the research that's been completed, particularly having demonstrations of tools that have been developed that are going to be particularly useful in the acquisition space. The first one we have is around policy flight simulators. That's by Dr. Bill Rouse from Georgetown. Dr. Annie Yu from Stevens will also be joining virtually shortly. So please welcome Bill.
Good. Well, thank you. We talked a little bit about policy flight simulators earlier in the day, and I thought it might be useful to give you a little overview of what we mean by that and some demos of ones that are actually been developed and in use. First of all, we'll start off with the definition and then talk through 7 examples of systems that have been developed or in development. The California energy system is in development, and the U.S. national security system. Talk a little bit about what do you do with these things once you have them? What kind of decisions do you make? And then a very high-level description. Okay, let's say you wanted to create one. How would you do that? So, policy flight simulators are immersive, interactive environments designed to support stakeholders' exploration of alternative management policies at levels ranging from individual organizations to national strategy. Now, where did this name come from? Okay, it's all due to Ruth David. I don't know if she actually realizes this, but I was presenting some of this work at the National Academy of Engineering, where she and I are members, and she was on a committee. And she asked, what do you call this thing? And I said, well, it's a multi-level enterprise model. She goes, oh, come on. You come up with something better than that. She says, isn't it really just a flight simulator, a policy flight simulator? And that stuck. And so, thanks to Ruth, that's where that name came from. Okay, here's the systems. We've got 2 in health, 3 in health, 1 in higher education, and then we've got a couple that are on the way. So, since Annie Yu isn't here, I'll introduce her in the screen. This is the immersion lab at Stevens. And these 7 screens portray the health ecosystem of New York City. Now, what motivated this question was, what are the 66 hospital corporations, not buildings, corporations in New York City, 66 hospital corporations, how are they going to react to the Affordable Care Act? We interviewed 10 senior executives to see what are their issues, what are their alternative ways of how they might react. And one of the big issues was who is going to acquire who. At that time, and I don't know if it's still continuing, mergers and acquisition in the healthcare industry was the most active sector in our economy in terms of hospitals acquiring each other, acquiring physician practices, clinicians, et cetera. So we developed this system and are able to predict who's going to acquire who. In fact, just to make sure this works, oh, I know what I have to do. Wait a minute. Got to follow instructions. It's already up and running. Now, there's got to be a way to minimize this screen, but I don't see it. You can tell I'm not an Apple. How do I get this down? Where is it? Okay, it'll come up. It takes a couple minutes. So this is the real thing. This is online. You can go use it. It's just taken a while to come up in our Shiny. And I'm not going to do a whole bunch of runs while we're watching, but we can do them outside later. but I just want you to see that this is real. There's a couple interesting things that come out of this. As we run this simulation for 10 years, we can predict who is still here and who buys who. And we're actually pretty good. We predicted several acquisitions correctly. And the one we almost got right. We predicted that Mount Sinai would acquire Staten Island University Hospital. But it turned out Northwell acquired Staten Island University Hospital. And we asked Mount Sinai about that. And he said, you know, they were actually the top of our list of who we wanted to acquire, and Northwell was just faster. And we don't have speed in this, so that was pretty good, pretty close. The 66 agents are modeled with income statements, balance sheets, operational performance, quality performance. They're very rich agents, even though there's just 66 of them. And they look for attractive targets to acquire or be acquired themselves. One thing's very interesting about this simulation is each run does not end up in the same results. There's a path dependence. The hospital everybody wants to acquire is Hospital for Special Surgery. They only do orthopedic surgery. They're their most profitable hospital in New York. Everybody wants to acquire. So what happens is a few of the well-heeled hospitals in the first year will make bids, which maybe none of them get accepted. Maybe one gets accepted. Then what happens, of course, is Hospital for Special Surgery is no longer independent. And the hospital that bought them has a very reduced balance sheet because they had to spend a lot for it. What that means for every other hospital of the 66 hospitals, the game has just changed. It's a new game. The big plum is gone. And so we see that we get different results and really like this idea of path dependence. In other words, the exact outcome is not predictable. Now, we can look at frequency of mergers and acquisitions, and that does have some strong patterns. And we reviewed this with executive teams from many of the 66 corporations, about half dozen of them, and a couple hundred other people from hospital consulting, healthcare consulting, et cetera. That's how we validated it. But the whole idea, and I want to go back to let's see if I can do this one right. Is that minimize? Yeah, it is. Okay. And I don't know if that's my slides or not. Just because there's windows, I'm not sure. Okay. We'll be okay for now. Thanks. Yeah. I want to go right back here because I think one of the interesting things is how do people react to this? You can see they're in a room, they're sitting around. Actually, the fellow in the upper left is the CEO of Accenture Digital, although he retired last year. What we find is people don't just want the answer. They want to explore the data underlying the answer. Okay, they want to explore the data underlying the answer. So some of these plots, the one that's just right to the right of Annie, well, some of those allow you to access the income statements and balance sheets of your competitors. And you can look at what population they're serving, what they're charging, what they're making, what's profitable, what isn't profitable. And so we found out that people were very interested not just in the outcome, but exploring the underlying data and the input to it. And the next one I'm going to show is a next model I'm going to show. I've got an interesting story about what we were able to do with it. So let me tell you about the second simulator, and maybe we'll get to see it in a few minutes. CMS, the Center for Medicare and Medicaid Services, had a policy on hospital readmissions. And if you were readmitted within 30 days of having exited the hospital, there's a penalty charged against your Medicare income. And University of Pennsylvania, Penn Medicine, had developed a protocol for helping patients not to be readmitted, so you'd avoid the penalty. But it costs a little bit to actually implement the protocol. So this is the transitional care model simulator. So what we did is we simulated implementing the University of Pennsylvania's program in every one of the 3,000 Medicare hospitals. And we asked the question, under what conditions would it be economically attractive to comply with the CMS policy? And if you complied with this program, then you'd avoid the penalty. What the model did, what the model did, if you can get to this slide, what we discovered was for the 3,000 Medicare hospitals, it only made economic sense for 10 of them to comply with the CMS policy. 10 out of 3,000. The parameters of the policy just didn't make sense. And people were better to just eat the penalty than to deal with the problem. So we went back to Medicare, to CMS, and said, well, we've evaluated your policy, and we think we understand why nobody's following it. How did you come up with those parameters for the policy? And the answer was literally, well, we had to come up with something. So you didn't analytically study whether this would make sense for people to comply? No, we talked about it, we never did it. So this is a case where we're able to show that a policy didn't make sense, and it would be really nice if we had done it before the policy was rolled out, but we didn't. Okay. And so that's another case of a policy flight simulator. And I'm not going to, we have this tool available online too. You can access these, if you've got the slides, you can access these anytime you want. You know, if the football game is not going too well, watch the simulator. Okay, let's see. Can you get me to this, to the Washington, D.C. crisis? Okay. Now, this is an interesting one. We developed an agent-based simulation model of the population of Washington, D.C. If you live in Washington, D.C., you're in the model. We have every household, all the occupants of every place in D.C. And what we were interested in was, could social interventions help to stem the opioid crisis? Not medical interventions, social interventions. Like, for example, peer recovery coaches, where a former addict engages with an addict and helps them to understand how to go through recovery. Because there's a lot of medical literature that says that works. So we developed that in the simulator, and this just shows the results. You can see, first of all, I learned a heck of a lot about Washington, D.C. I live in Ward 3. The average life expectancy in Ward 3 is 22 years longer than Ward 8. It's just astounding. But anyways, you can see as we move on here with more social interaction, things get better. We had the fortune of running an unfortunate real experiment. The unfortunate real experiment was the pandemic, where people who were more socially engaged now became isolated. So the social interventions that we had simulated in the interaction could no longer happen. So we ran the model, and what it predicted was an increase in overdoses and deaths. And we were right in the ballpark of what actually happened. It's amazing to be able to run these in experiments with actually what's happening in the world. Again, very unfortunate, but that's what happened. So if you live in DC, you can feel comfortable that you're represented here. You might wonder, well, how could we know that much about you? They're actually, we know the street addresses and the occupancies and all that sort of stuff from the census, okay? We have other data sets from a couple of sources that provide synthetic data matched to the population of any city. Okay, so it's not really your health data, but it's representative of your health data. Okay, I'm going to go on to the next slide. So this is what we're doing in California right now. California, okay, it's just blinking here, not there, good. California is trying to go to zero carbon in 2050. And I was working with a group of, they're mainly chemical engineers and operations research folks, who are trying to figure out what is the component energy systems, solar, wind, hydro, backup gas, fired plants, et cetera, that will get us there by 2050. And they have a very sophisticated set of models to do this. The problem is that the people who are at the California Energy Commission, the Public Utility Commission, et cetera, are not engineers or data scientists. So when they report about these models, it's just, okay, just magic to me. I don't know what you're talking about. So they said, can you create an environment where they can actually explore the models, talk with each other, have debates? And this is where it stands at the model right now. We have a lot of models. I'll come back to the actual identification of models in a minute. But these are the key stakeholders who need to be in the room to be able to debate the alternative strategies. And what we found, and you'll see this in a slide, a couple slides in a minute, is their ability to explore, debate, look at the complexity of their problems, and especially see each other's point of view makes a huge difference. When we did the one on the readmission penalties, we had senior executives from the providers and from the payers. And we had two views, the provider's view and the payer's view. And the provider has to give the service to the patients to avoid the penalties. And the payer, of course, doesn't have to pay the penalties, right? It turns out the provider is making all the investment, the payer is earning all the returns. Not a good strategy. So we made it so they could see each other's view. And I remember one of the payer executives said, gee, you're making all the investment and I'm getting all the return. I might really like you to do this, but I can't imagine you would sustain it in that situation. So I'll tell you what, I'll split the profits with you. The provider said, okay, now we're talking. The ability to see each other's views of the problem often results in really creative problem solving, not because the tool is smart enough to know the creative solution, but it's presented the data in a way that everybody can see their different views. And they can see each other's view. That makes a big difference. Next slide. No, back one. Back one. Right there. No. There you go. So we started to think about, and this is really just notional, what if we did this for DoD? What would the room look like? Well, we'd certainly want the perspectives of the different services. We'd want to get OSD, both A&S and R&E, right? Have views of them, and places like DARPA, but also the Armed Services Committees and the Appropriations Committees and the contractors and the combatant commands. How can we bring together all this data that Laura and Phil are going to make easy to access for us? How can we bring all this data so all the key stakeholders can be in the room and talk about how these things interact? Well, I didn't show one here, but we did one for universities. And I remember demonstrating this to some deans and a provost, et cetera, on the different screens, the different parts of the university. And these people who were senior leaders in the university for many, many years were discovering things about their own university they didn't know, because they just had never looked at that data before. And you get questions like, hey, look, if I move this, look what happens over there. They were discovering this in the process. So let's go to the next slide. Okay, so what's the impact? Stakeholders are immersed in hands-on experiences. One of the things we've discovered, especially in that we've done several of these in healthcare, is when one of the key stakeholders says, well, how do you handle X in the simulation? We say, well, actually, we don't even know what X is. Can you explain? And the person explains what that means and why that's important. The next meeting, X is on the screen in the simulator. Buy-in immediately. My idea is up there. That makes a huge difference. And of course, you're getting this from lots of people. And they're getting to explore hands-on. Again, these people aren't going to play with differential equations or stochastic models or whatever. They want to put their hands on the controls and try things. Second, they understand what might happen. We make no promises that a prediction from this model will happen. We're saying it could happen under the following circumstances. And here's something else that could happen under the following circumstances. And anyone who tells you that they can predict for you exactly what will happen, you shouldn't pay attention to that. You want a portfolio of what things might happen and the conditions under which they're likely to happen. You learn of leading indicators. Well, I would really like it if X happened and Y didn't happen. Well, what are the leading indicators about whether that's going to happen or not? What are the best predictors? Not guarantees, but predictors. We can provide that. The fourth one is one that you might find interesting, because you might think, well, I want this simulation to tell me the answer. And we already said, well, we really can't tell you the answer. But what we can do is we can help you to get rid of bad ideas really quickly. And we've had many circumstances where we've been able to investigate, say, the senior team, the healthcare system. They've got 6 ways we might proceed. We can show them that afternoon, these 4 ways will not work, and this is why they won't work. So let's just debate 2 and see how we can look at the nuances of those. Getting rid of bad ideas quickly is extremely important. And I've asked executives, gee, all we did was get rid of bad ideas today. Was that helpful? They said, do you realize how much time we would have spent on those bad ideas if we hadn't got rid of them? And then finally, they gain enhanced mental models of the values and concerns and perceptions of the other stakeholders. Okay. Now you could say, well, they could just talk about that across the table, right? But when they see it up on the screen, what we find is it's no longer sort of a debate about what you feel and what I feel across the table. We're looking at the screen. We're looking at the model. We're seeing the implications of those things. And if actually your perceptions are different than what we're simulating, it will tell us how they're different. Okay. So you can see this is a very interactive process. We're not trying to do, I don't think we want to do a policy test range where it comes back and says, okay, 1 wins and 2 and 3 are losers. I don't think we could do that. I don't think we're good enough to do that. And I don't think that's the nature of the social dialogue that you want. I think I have one more slide. Well, now how do we do this? How do you create it? What we don't do is take a bunch of modelers and say, okay, go simulate the healthcare system. You engineers and statisticians and everything, come back when it's done. Okay? We're not going to get anything useful that way. We start off with key stakeholders. Say, what are your questions? What keeps you awake at night? What do you think are your big risks? What things would you like to know more about? Okay. Totally driven by what the user wants help with. The second thing is we don't go to data yet. We don't go to models yet. We go to phenomena. Say, okay, that question is really interesting to you. What phenomena affects it? Well, it's affected by stakeholder engagement. It's affected by the economics of the intervention. It's affected by staffing. Okay? These things have an impact on the issue I'm concerned with. Once we've determined that, then we start to ask, okay, what models could we employ to actually make predictions about the phenomena that are of interest? And then we want to parameterize those models, so where's some data? Now that doesn't mean all the data waits till the end. It's used in detail parameterization. And it may be used up front to say, gee, it appears that this phenomena affects this outcome, and we didn't know that. Okay, well then we're really concerned with the phenomena. Okay? But we've done this enough times now that we know that this process leads to very significant stakeholder engagement. Very significant sense of being part of the design team, not just the recipients of advice. And we think that's a key element of why these things succeed and why, if we follow this idea, the policy test range will be a success as well. So that's enough. I'm glad I don't have any issues with blinking screens. If any of you speakers do, okay. But anyways, that's my story.
So roughly, ballpark speaking, how much does it cost and how long does it take to build one of these things?
Well, I think the one we did for the CMS was $400,000 from Robert Wood Johnson Foundation. The building of the simulation, because we'd done several before, took about a month. It took about 6 months until we really understood the problem. After a month or so, us at Stevens, including Kara here and Annie Hughes online and Mike Pennick, after about a month, us and the Penn Medicine people feel like we were really in the groove. And after about 3 months, we realized we didn't understand each other. And we sort of homed in on what is the real question. The New York City simulation, Annie did all the reverse engineering to get all the financial statements because the hospitals wouldn't give them to us. I think that took her 6 months, one person. I think you should be able to produce a initial usable prototype for about $500,000. Is my guess. Now it depends. In all of the ones we've done, we had access to the data we needed. So we didn't spend like weeks and weeks and weeks begging for data. We were able to get it. The California example, which we're right in the middle of, a meeting on Friday, it's all being done by chemical engineers and operations research types. So one of my first questions for them was, well, how do you represent the consumer? Whether it's a residential consumer or an industry consumer, right? And they said, well, we just assume that they will moderate their usage to follow the variable pricing. I said, well, what if they don't? He said, well, I don't know. Who knows? So that's got to be in your model. You've got to include a representation of the consumer, not just the technical side of it. But what that does is doesn't really add a lot of money to it. It adds time to figure out what's the right thing to do. Other questions?
The hospital test simulator that you built seemed to be like a one-time effort, but I think there's some interest in the effort for this flight simulator to be an evolving effort, one that continues to expand and capture more of the ecosystem and test out different policies. Can you talk to that concept?
Well, first of all, I think in healthcare we've done 6 of these now, and each one gets easier, in part because we know more about healthcare, and we know more about health economics. So I would view the prototype as just a platform to expand onto these other issues. And in fact, this happens almost every time. We show the sponsor the simulator, and sometimes they weren't really sure what they were going to get, but they were enthusiastic. We show it to them. They're usually, in this case, healthcare people or education people or energy people. They're not systems people. We show it to them, and almost every time they go, wow, this is really cool. Could you add X and Y and Z? And that's how it evolves. They become part of the design team. We learn from them. And so it is very much evolutionary. But it does seem to me every once in a while you have to stop and actually support a real decision so people feel that they get payoff. Even if you're on this evolutionary path, you need to do both.
Bill, could we go back to your national security slide?
Sure. I think the gentleman in the back can do that. I don't know if I can. Can you put up the second slide from the end?
There.
Next one.
Next one.
That's
Okay.
it. That's it. Okay.
So one of the big problems that I think I and many of my compadres have seen, when you look at, if you look at national security.
By the way, I apologize that NASA's not in there.
No, that's okay. Maybe
Okay.
they should be, but I'm just saying that
Okay.
if you look at this from the bad guy point of view, they don't care about any of this. They will grow and sell illicit drugs. They'll do threat finance. They'll run across the border. You know, they don't care about our JSIDS process or whether we have an acquisition arm or any of that stuff. So the problem with national security is we don't have this overview of how does DOE or DITRA or Commerce or State Department or all these other elements of the federal government interact for what we would consider to be security. We don't have this overview in a broad sense.
Yeah.
So
I didn't depict it here, but in some of the other ones we've done, we actually will have a simulation of your competitors and what they're doing. But I think you're making a more overarching point, and this is just notional. I mean, it's not like
our third world guerrillas and terrorists run all across the map on our federal bureaucracy, and we don't have a map to say, you know, where should we put our thumb down and, you know, stop the bleeding, basically.
Yeah. It sounds like another use case to me.
Yeah, it's just an idea for you.
Yeah. Any other comments or questions? We're about the time anyways. Okay, good. Thank you.